I'm here with Jamil Mahmood from the Main Street Project. Thank you for being here with me today.
Thanks for having me.
Tell me a little bit more about your organization, the communities, and the population that you serve at Main Street Project.
Yeah, so Main Street Project's a harm reduction organization in Winnipeg, Manitoba, and we serve folks who are homeless or unsheltered. That's our primary target. So we offer a number of different services. So we have emergency shelter. So we have a 120 bed shelter facility located at the corner of Main and Logan. And that offers all the stuff that comes in the shelter. We're a low barrier shelter, so we allow people to be in whatever state they're in, whether they're using substances or whatever state they're in, they're allowed in our shelter. And so we have daytime sleep, overnight sleep. We're open 24 hours. We only close for cleaning twice a day. We offer food, clothing, showers, washrooms, and a safe place to be, and then connections to staff and caseworkers. We provide, we look to do kind of rapid rehousing through our shelters. Folks who are in shelter who want to get access to housing supports. We have caseworkers that work on that piece of getting folks housed. Then we also operate two housing buildings. So one mainstay housing is transitional housing facilities. So that allows folks to transition often after going through addiction treatment and need a place to stay in a transition period. Well, they'll stay at mainstay for that, or if they're coming out of hospital and need a place to kind of heal, that's another kind of one of the main uses for mainstay transitional housing. Then we offer the Bell Hotel, which is housing block, the former hotel on Main Street that offers 42 units of housing, and that's more stable housing, but it's still supported. So we have staff there 24/7 working with the tenants, providing them with, access to healthcare support, making appointments, those kind of things. So it's not transitional, but it's supportive housing there. And then we run all the non-medical detox for the city in Winnipeg here. So we have a men's and non-binary detox at our 75 Martha location, and then we have a women's and non-binary detox at River Point location. So we offer both. Those are 14-day detox programs that are often the first step for folks on recovery journey dealing with substance use and problematic substance use. And so that's a really important part of our kind of role as a community health agency, is providing that access to treatment and care, and we primarily are kind of the lead of that access for Winnipeg for folks getting into addiction treatment and care. We provide all our service non-judgment, so it's not necessarily people going into treatment. You can just come into detox if you need to detox, and we provide that support. And we provide a mix of different options for detox, whether it's for folks going, detoxing from substances, or folks going on, methadone, Suboxone, or OAT type treatments, opioid agnostic therapy treatments. We provide support for that as well through our detox programs. And then we also offer a 24-hour van outreach program, and that is on the streets, 24 hours. It serves a couple of roles. One, it's a connection for folks who are living unsheltered in encampments to services and resources. Primary care, we have a model that provides a support worker, a caseworker, and a peer worker. So someone with lived experience in that model, and that also we have a role in providing STBBI testing to folks and access to primary care through our van. And in this this COVID time, we've also been providing vaccines on the street and in encampments, and we have a doctor and a nurse coming out in our van and providing vaccines and primary care to folks who are unsheltered and living on the streets encampment. And we also provide emergency transportation for folks as well. And that is Main Street Project in a nutshell.
You guys are doing a lot of amazing work. So what is the current situation in Manitoba in terms of access to community health centers, and why do you feel that you need more community health centers in the province?
Yeah, I mean, it's really challenging because there's a lot of mistrust in the health system, right? And that's where I think the biggest role community health centers play is folks who have been, affected. In Canada, the legacy of colonization and residential schools and those kind of systemic ways healthcare has been used in the past to keep people down or oppress people or run tests on people. Those kind of things that have happened in the past. And so when that's people's lived experience, it's hard for them to access system-based kind of healthcare, and whereas if it's done in a community setting, in a place that people trust and incorporates, community supports and that care that comes with community health centers and that passion for meeting people where they're at and giving them the support they need outside of what a medical system provides. And so I think that's really one of the key things that community health centers provide is they meet people where they're at, and they provide open doors for people to go through to access care, and healthcare is one of those main things folks access. The need, a good example, our location is immediately across from the Winnipeg Regional Health Authority Access Clinic, and people want to cross the street to go there. But they'll work with us. They'll come through us to the places we connect to. They'll work with our partners at Aboriginal Health and Wellness. Another community health center has it's just down the street, Mount Cobra Clinic. Groups like that. Other community health centers in our network here in Manitoba, Winnipeg. There's a in Manitoba, folks. There's no community health centers outside of Manitoba currently, so that's something that we hope to see addressed. But we have a good network here locally in our city that we meet regularly. We're communicating well, and we're addressing kind of all the issues that come up in community, and work to kind of remove any barriers or things that cause folks to not have access.
So considering the wide range of services and programs that Main Street Project delivers, you've especially mentioned housing and addiction services, what would increased federal investment in community health centers enable your community health center to do for the population of Winnipeg?
I think it would allow us to create more access. I think, for us, the work we do, as we're slightly different from standard kind of community health centers, because we're emergency shelter based as our core operation. I think we provide that link for folks that don't want to go into a formal healthcare setting, and we allow folks to bring it in our building, right? So either us having increased, healthcare staff capacity like nurses and nurse practitioners on staff, or our partners getting increases, allow them to come into our spaces to do, critical testing and treatments. And then the big thing, obviously the pandemic is very huge on all our mind. But what we noticed with the pandemic is a lot of the kind of barriers, or especially to accessing funding to provide direct care, we expanded dramatically to be able to create isolation spaces here in Manitoba for the unsheltered homeless sector, and we were able to get those up and running and funded within a week, right? And I think that's where I think the investment in community health center means we can do a lot of work to really get services where people are at, whether it doesn't have to be coming through a door into a clinic. It can be going to meet them on the street, meeting them where they're at, and getting them that access to primary health care, and then long-term supports follow up. And I think that's where federal investment is so crucial. I know the funding structure is the federal government funds the province, which then, but the federal government has a lot of abilities to make sure funds go to the core areas where they're needed, and homelessness and unsheltered populations is an area that is just often left out of the healthcare conversation. And so we hope that our work as a community health center and in our network, that we can work to bring the healthcare to where people are at.
Wonderful. Thank you so much for your time today, Jamil.
No problem.